Okay, you're fine.
Hi, Ms. Bauer. My name is Abby. I'm going to be your student physical therapist.
Hi, Ms. Bauer. I'm Kylie Olmstead. I'm going to be your student physical therapist as well.
You guys can call me Caitlin.
Okay, all right.
Hi, Caitlin. So we hear that you've been having some hip pain. You have a lot of pain in your left hip, and it's happening as you're running. You're having problems bringing your leg forward through, kind of feeling like it's tight when you run, and also told us about bilateral hip popping, so it's popping on both sides. So we're going to run through a couple of tests with you today. I'll be running through the first two tests with you, and then Kylie will be running through the second two. So to start out, we're just going to go ahead and look at your posture. Okay? So I'm going to have you stand up, and you're actually going to, we'll have you face this wall right here. And then we're going to have you lift your shirt just a little bit, and then I'm just going to start looking at that posture. All right. So my hands are a little bit cold. Okay.
What are you kind of seeing there, Abby? What are you checking for?
I'm looking at the iliac crest and see if there is, if they're level. And it looks like it's a little bit higher on the left side. I would say that might even be a little bit.
Sorry, my hands are cold, Caitlin.
I mean, it looks.
I would say that's pretty level. Maybe like a slight, higher on the left side here. Yeah.
So yeah, actually pretty level.
Actually.
Okay. So that's level then. All right. I'm just going to move my hands down a little bit. Do you mind if I pull this?
Oh, no, you're good.
We're going to move down to
PSIS.
the PSIS, and then, okay, this is definitely a little bit higher. I'm noticing. You feel right in there. That's definitely as much as, so that's higher on the left.
Yep.
All right. So now I'm going to. Do you mind if I roll your shorts?
I'm just gonna roll them up a little bit and tuck them.
And I'm just going to take my hand and kind of move up towards the side. And I actually want you to take your foot, and then I want you to twist it in and out for me if you can. Okay? And then can you do that to the other leg as well? All right. I'd say that's pretty level right there.
Yeah, I think so too.
That's pretty level as well. So we looked at gluteal fold symmetry and that greater troch, it was horizontal going across. So now we're going to look at the back of the knees. And that is level there.
Sure.
And let's see. Now looking down here at the ankles, is it still in view?
Yeah,
I don't think it's still in view for the.
Okay. Yeah, I'll move it down low. There we go.
Okay, so down here, it looks like there might be a bit of pronation here.
Let me get
So
you right
that would be some eversion,
Yeah.
calcaneal eversion right there. And I'd say that's bilateral. That's on both sides.
Yeah.
Okay, so now what I'm gonna have you do, Caitlin, is turn and face towards me. And now we're just gonna look at the front. So, if I can have you lift your shirt again, and we're just going to, pretty, iliac crest is even. So we're just looking right here above your, at your hip, which is the iliac crest. And then this right here is pretty, I mean, I'd say it's pretty even as well.
Yeah, it's pretty level to me.
Okay. And now I'm gonna reach up here again on both sides, and then can I have you twist your left leg? Yep. And now your right. Okay. Yeah, that's even right there. Muscles are, I would say, there's symmetry between the strength and the muscles in her
Yeah.
quads. And then the knee positioning looks good. and the joint itself is level as well. So, and then going down the leg, that looks great. And the arches. So the arches they look good too. So now what we're gonna have you do is you're going to face me. So we'll have you, perfect. Just face me and we'll look at this side of your body and then we'll switch you over to the left side. So, looking, and then can I have you raise your shirt just a little bit? Alright, so we're going to look at the ASIS and the PSIS. So between the two, I would say that's about a 10-degree difference in angle, so that is normal.
Okay.
Now we're going to look at the top of the iliac crest, and can I have you turn that foot in and out for me again? Okay, perfect. So that's in line, which is what we're looking for. The knee joints. I'd say there's a slight hyperextension in her calf.
Yeah.
But the knee joint looks good other than that.
Gotcha.
And then the
Kinda
plumb line in her,
Forward a little bit that way. So
and then right here, the plumb line that we're looking at, it's slightly anterior. If we go up her body, it would be right in line. So that checks off well. And then her toes on this left side look great. So now we're just gonna look at the right side really fast. So then, Caitlin, can I have you face this wall? And we'll just do the same thing one more time. Thank you. So, can I have you turn in and out? Okay. And then that is in line right there. I forgot to check the alignment of the ASIS and the PSIS, so we'll do that really fast.
Looks about good.
That's probably 10 degrees, so those are normal as well. Double check right here. All right, the knee.
I
Again,
see as much hyperextension on this side.
I see, well, looking at it now, from if we kind of look back at this angle, there is more on the right than there is on the left. I still see a little hyperextension though. And then going down the side of your leg, again, the plumb line is slightly anterior to the malleolus if we're going up
Yeah.
her body, and then her toes look great too.
Okay.
So,
Perfect.
all right. So the next thing I'm gonna have you do, we'll kind of explain what we just went over after we do all the tests. But until then, I'm actually going to see if you have any tightness in your hips and tightness in your quadriceps or the front of your legs, and then on the side of your legs. So I'm gonna have you walk over to the side of the table, and then I'll have you lean back like this, and then I'm gonna have you bring one leg down, and we'll take a look at that, and then we'll do the other leg. We'll start off with your right leg, and then we'll go to your left because the left leg is the one that's been bothering more. So we want to get a good base measure. You can go ahead and lean back. Hold on to that. So again, we'll start with the right because that's the one that isn't bothering you as much. And I'm just gonna have you bring your leg down. All right, so you're positive for this test. So what we're gonna have you do is we're gonna have you come out to the side and bring your leg down. Hopefully you can see the videos of that. Yeah, it's a pretty clear view there. now I'm gonna do this on the other leg as well. And I'm, for purposes, I'm just gonna stay right here.
Okay.
Let me bring it.
No, you can,
You want the video?
yeah.
No,
Just kind of like sit in front of here. I think
we'll have you come down then.
it'll be good. Yeah, you can still see. Pretty good.
Okay.
I'd say that's tight as well.
Yeah, that's definitely positive. And to the side. And bring it down. Are you okay? Did that hurt?
Yeah, a little bit, but
I'd say that's tight as well.
Bring it up. And we'll bring it down. Start to relax a lot.
I feel like I'm butt cheek.
No, it's doing great.
I'd definitely say
That
that's
is the
yeah.
hardest for us. Okay, so where did you say it hurt when
It was,
Going out to
it
the
was
side.
anterior.
on the, so I was on the front of your,
Uh-huh.
okay. Awesome, so what we're gonna have you do right now is just go ahead and scoot back onto the table and then
And I'll take over for the
Kyle's
next
gonna do
couple
the next
tests.
few tests.
Can we just move this over just a little bit?
Switch.
That's good. Alright, so this next test is going to be a posterior glide. So I'm just going to take this and put it underneath your leg here. I'm just going to have you just relax. I'm going to get under your shorts here. Is that okay? I'm just going to rotate your leg, just trying to find your greater trochanter. Alright, so I'm going to stabilize here. And then if you hurt at all with this, even though it's like the uninvolved side, if it hurts, just let me know. How's that feel?
Fine.
So now we're just going to go over to the other side. Do the same thing here. Rotate ya. How does this feel? Was it Like you feel pressure or like feel?
I'm gonna take this pillow really fast. I'm just gonna
Move
move
it
it
up a little bit.
I'm gonna fold it a little bit more. Okay, right here at the knee.
Okay.
Okay, there we go.
But I feel like
Does
there's
that kind of like change it a little bit more?
yeah,
Okay.
definitely feel something in the front.
Yeah, and you said that most of your pain was like interior pain?
Yeah, it was kind of all over pain.
Okay. But when you're running, like when you lift your hip up like this, is it more like flexion pain that you feel?
It just feels like I'm like rotated.
Okay.
What level, like what grade were you doing the
Just doing
distraction?
a 3 and then I went into like a 4.
Okay.
Alright, so this next test that I'm going to do is called a Fadir test. Or Fader, however you want to say it.
I don't know.
Would you double? Would you like
I would do a double as well.
Well, I don't necessarily need it for this one, but when I take you up, I'll let you relax back down on the pillow, okay? So we're just gonna pull you into flexion here, and I'll let your leg rest into me here, and then I'm gonna put you into adduction and then a little bit of internal rotation. I'm gonna put some overpressure here. Again, if it hurts, just let me know.
I feel a little bit, but it's just a little uncomfortable. It's not painful.
I'm gonna take the pillow out because it
Yeah.
might just get annoying now, but it was a good to start out with.
Right.
Yeah.
Okay, so now that we're going to go to the side that you get more pain from, again, just let me kind of take your leg here. Turn and rotate you.
Bring you towards me a little bit more for the internal rotation.
How's that feel?
That one? Yeah.
Better?
Yeah, I definitely feel something internally and anteriorly.
Okay.
And even part of my back, like my butt, too.
And just, I think even like, if you went into it and then held it down, just to see if there was any pain just while you're holding and
Okay.
pushing through
Let
that.
me move her down just a little bit more. I feel like I can get a better handle on it.
Yeah, you're fine.
That's all.
sit down.
Yeah, kind of scoot just a little bit more to me.
Yeah.
It might be a little, I'll connect it here for you. Try now.
There we go.
I stepped on it.
I think if I lower it down, I can get more on top of me. Yeah, that's better.
it's like right here and here.
Okay.
Okay, I don't know.
Okay. All right, we'll go ahead and have you like sit up and we'll kind of talk to you about like what we think and where we go from here.
I think that's all for the video. Do we need to describe anything in the video?
I think we're good.
Okay.